Welcome everybody to the many uses of ozone. I am Dr. Marlene Siegel, and it is my pleasure to spend the next 40 minutes sharing the power of ozone in clinical practice. I think it's pretty clear in today's day and age that we need to have a bigger toolkit. You know what they say is that if the only tool that you have is a hammer, everything looks like a nail. Well, when I was in school, they taught us that no patient should ever die without the benefit of the silver bullet. And the silver bullet when I was in school was prednisone or steroids. Well, you know, prednisone and steroids are great when you need them, but they also have a lot of side effects. So I think it would be neat if we had something that was another different kind of silver bullet that was safe. It was extremely effective. It was highly cost effective. Can you imagine something that didn't cost a whole lot to bring into your practice, didn't cost a whole lot to the client to be able to use it, had a minimal learning curve for you and the staff, and it's technician-driven service. In other words, you don't have to do it. Ozone, there's your answer. So what is ozone? It is a pro-oxidant. It's actually made by nature. So when you have energy from, like, say, electricity, lightning, and it strikes the oxygen molecules, it splits them apart. And when they come back together again, they form 3 oxygen molecules. It's a very unstable form. It's highly energized. And then it's a powerful sterilizer. It's the most powerful sterilizer known to mankind. And it has a very short half-life, very reactive. So why do we want to use it? Because the ozone, when we administer it medically, increases reactive oxygen species. Sounds like a bad thing, but we actually need these reactive oxygen species to be able to turn on our internal antioxidant production. Really important for our immune system. Ozone selectively kills disease cells and pathogens. It is an increase in oxygen will help the immune cells to work better. Ozone will also increase interferon and tumor necrosis factor. But here's the one I think is most important, is it activates NRF2. NRF2 is an enzyme that turns on over 200 anti-inflammatory pathways. Ozone is also known to activate the Krebs cycle by increasing oxygen. You get more oxygen going from the blood into the tissues. It helps to form all kinds of coenzymes, and it increases the ability of the mitochondrial transport system to do its job better. Your red blood cells have more pliability. There's more arterial oxygen. Ozone breaks down petroleum-based toxins, so it has a little bit of a detoxification effect. You have better leukocytosis and phagocytosis. It's germicidal. And it also creates a feeling of well-being, which is when you give it to certain individuals, they actually feel calmer and they feel better. So when do we need ozone? Well, anytime you need more oxygen, you need ozone. We use ozone in dentistry with stomatitis, gingivitis, and also rinsing out the area where we've done an extraction. Ocular irritations with allergic and infectious diseases, acute and chronic otitis, upper respiratory tract infections, whether they be bacterial or viral, autoimmune conditions, vomiting, diarrhea, resistant infections, cancer, skin problems, upper respiratory tract infections we mentioned, and UTIs, wounds, snake bites, and infusing into anal glands, which I'll show you later. So the most common applications for using ozone is major autohemotherapy. That's where we take some blood from the patient, we mix it with ozone, and then we put it back into the patient. Rectal insufflation is where we take a catheter and put it up the rectum and take the ozone gas and insert it. Lavaging ears, being able to lavage oral cavities, lavaging wounds, bladder insufflation, abdominal lavage, minor autohemotherapy. I'll show you a case of that. Take a little bit of blood from the patient, mix it with ozone, break the red blood cells down. And for those of you who do homeopathy, you'll understand this method. And then we inject it into either tumors or under the skin. Lavaging eye ulcers, subcutaneous fluids, using ozone as acupuncture, and also doing it with prolotherapy, where we take and inject solutions and ozone into joints, like for a cruciate injury. This is rectal insufflation. It's the most common way that I use ozone in my practice. It is easy, it is very quick, it is requiring minimal amount of technicians and tools. I use it for animals that are ADR, ain't doing right, vomiting, diarrhea, really anything that needs a boost to the immune system, which is almost every sick patient you have. We do a quick rectal ozone on that patient. So one would ask, well, how do we know it's actually doing anything? You're putting it in the rectum, what's actually happening? So this is light field microscopy. This is a drop of blood that I took on an animal before giving rectal ozone. And you can see that there's a lot of rouleau. I would almost call this aggregation because these cells are really ugly looking. And then we gave the rectal ozone, and voila, there we have some beautiful cells. So ozone is affecting the fourth phase of water, and it's helping to increase the cell pliability and the ability for these red blood cells to do their job most appropriately. This is the minor autohemotherapy. I've taken some blood from this dog. She had some little skin tumors, and after breaking down the red blood cells and mixing it with ozone, I inject that back into the tumor. Now, I want to share with you my 5 keys to healing, because I think this is really where the magic occurs. It's not about trying to use ozone as a pill for the ill or a diet for the disease. It's really about treating the whole body system, but using ozone as an extremely effective tool to affect a lot of different areas of the body. So the first thing we teach our clients is, how do we stop polluting the pet's body? Super important. Food, water, environment. And then the second thing we do is make sure that that animal has all the essential nutrients that it needs to be able to perform the right metabolic functions. Third, we work on healing the leaky gut. Number 4, we do detoxification of all 6 organs of elimination. So kidney, colon, lungs, liver, skin, and lymphatics. And then we work on the mitochondria. We want to have the biggest, strongest, healthiest mitochondria producing the most energy for the body. So let's talk about some cases now. The rest of the presentation is going to be very practical. I'm going to show cases that we typically see in our practices every day. This is Rufian. She's 8 years old, intact female, hint, hint, and she presented to the emergency clinic for acute vomiting, anorexia, and basically ADR. The emergency clinic thought she might have a PIO, so they did an ultrasound, and they didn't see a PIO. Well, that was great, but they failed to do the rest of the workup on this dog. They sent her home with an anti-vomiting medication, and 3 days later, she was in my office, sicker than ever, super high white count. I'm thinking, well, maybe they missed the PIO, so I went ahead and did a full workup on this dog because I wasn't going to make any mistakes. And my first differential, of course, was a PIO. However, it wasn't a PIO. This dog had a stone blocking her ureter. And if I would have opened this dog, I probably would have killed her. So with the ability to get a diagnosis the day she presented, I sent her to the University of Florida that night in the hopes that we could save her kidney. They didn't feel like we could save the kidney, so they were going to charge the owner a whole lot of money to take the kidney out, and they couldn't afford the price that they were quoted. So she came back to me. Before I sent her to the university, I did major autohemotherapy on her. I wanted to give her as much oxygen and support as I could. When she came back, we did the surgery, took the kidney out. And I'll tell you guys, when I opened this dog, that kidney was spewing a fountain of pus. It was just pouring out of that kidney under so much pressure. So I knew we were going to have pancreatitis. I knew we were going to have all kinds of infection in this belly. After we got the kidney out, I did massive amounts of ozone lavaging throughout the abdomen. She did get sick for a few more days. She had a very mild case of pancreatitis. But by the end of the week, this dog was back to normal. Blood count was back to normal, eating, playful, happy. She never looked back. We did do rectal ozone on her for the 3 or 4 days that I hospitalized her, and we did spend the night with her in the hospital because she was so critical, but she did fantastic. This is Charlie. Charlie is that typical Yorkie that comes in, chronic allergies, chronic vomiting. This dog has had pancreatitis before, been on all kinds of medication for the allergies, just wasn't getting better. The owner was complaining that this dog was always having a grumbly tummy, and as soon as she heard that, she knew that the vomiting and diarrhea was right behind her. In our workup, we found that this dog had immune suppression, had lymphatic stagnation, was amino acid deficient, fatty acid deficient, vitamin D deficient, had a little bout of pancreatitis going on, and liver enzymes were elevated. So we targeted the root cause of the problem, and this owner didn't live very close. So we knew we needed to have ozone done more frequently than what she could physically come in and do. So she bought a hummingbird. She bought an ozone machine that she could do at home. She came to us for the therapies that she couldn't do at home. And within just a few short months, not only did all the skin clear up, all the itching went away, liver enzymes went back to normal, all this dog's GI problems have resolved and have not come back. So this is a bladder stone that I am taking out. Wonderful opportunity after you get the stone out to flush that bladder with lots of ozone. Make sure you've cleaned everything out in there. That's the way we lavage, and then we lavage the abdomen as well. This was a dog that came to us because he had a resistant Pseudomonas infection in the bladder. He was a paralyzed dog, and the owner was not able to express the bladder well, so he kept getting recurrent infections, and this was the one that was going to do him in because there was no antibiotic that was going to touch it. So he came to us. We would catheterize him, empty the bladder, put ozone into the bladder, and then I went to take a picture simply to see if the owner was able to express the bladder well enough, and I saw that he had an osteosarcoma. It was probably missed because the dog wasn't ambulatory. We were still able to extend this dog's life by several more months with a lot of quality, just because we were able to support him. This was an anal gland infection that came in. I'm going to play this video for you. What I ended up doing is I took a little Tomcat catheter and I went into the anal gland, and you're going to see the blood come back up into the catheter, so I know I'm in. And then very gently we flush until we don't see any more blood. So anywhere from 5 to 10 cc's of ozonated saline. And then we repeat this for 3 to 4 days in a row. And I've been able to clear up every single anal sac infection with this method, not having to put them on antibiotics. This is Bojangles. He came to us because he was ADR and his abdomen was becoming distended, and the owner got concerned. So we brought him in, did a full workup. He had a lot of ascites in his abdomen. It turns out that he's a non-neutered dog, so he had a prostatic cancer. We brought him into the hospital. We neutered him. And in this video, I am tapping off more of the fluid, and then I'm going to inject ozone into his abdomen. So I've tapped this dog twice before the surgery while we were getting our diagnosis. He had a full echo. I wanted to make sure that his ascites wasn't due to cardiac disease, which it wasn't. And then we found the mass on his prostate when we did his abdominal ultrasound. So there we are tapping. You want to take a good amount of the fluid off before you put the ozone in. And now, if you can hear carefully, you should be able to hear the ozone going in. That is literally the ozone bubbling into the abdomen. And all I'm using is a little butterfly catheter. Then you want to be able to mix that all around. So I just took my hand and just kind of bounced the belly around until we got all that ozone mixed in there. And he is doing phenomenal. This is Little Bit. Little Bit came to us. She'd already been on processed foods her whole life. She's 15 years old, a lot of toxins in the environment. She'd been having seizures. Her veterinarian had put her on some Keppra. And the morning she presented to me, she was almost status epilepticus. She was in lateral recumbency. She had no ability to even recognize anybody around her. So we put a catheter in, we gave her Valium, and I took the advantage to give her major autohemotherapy since we already had a catheter in. And this was her a few minutes after we had given her the ozone. Now she still has nystagmus, but she's actually sternal, where before she couldn't even sit up sternally. And then we did a few more therapies on her. Our #1 differential based on her history was a brain tumor. And we did, this was in the evening after we had done a bunch of therapies to her. We're probably 6 hours down the road. Her nystagmus is totally gone. She's able to sit up, she's able to walk, and she was willing to eat. We offered her a whole slew of things. I was pretty sure this dog was going to be vitamin D deficient, B12 deficient, and very toxic. So we started her on some binders to chelate the heavy metals and such, and started her on some vitamin D and B12 and some gut repair. And when I got her blood work back the next morning, sure enough, she had a mess going on. Her spec-CPL was off the charts, amylase, lipase, alkaline phosphatase, liver enzymes. I think this dog was probably cushingoid as well. But here's the magic. This is the dog the next morning. So this is less than 18 hours later with the therapies that we did. This dog is trotting home looking like a normal dog. Very happy owner, very happy us. This is Holly. She presented for allergic skin disease. At the time, we didn't have that diagnosis. She'd been to 3 different veterinarians, had had a boatload of steroids and Apoquil and all kinds of drugs and tons of antibiotics, and this dog just was not getting better. She was excessively itchy. She had craters all over her body, inside her thighs, outside of her legs, on her chest. It was just really miserable dog. So we did our full workup, gave her ozone and changed her diet. And this is her 3 weeks later. We did put her on antibiotics because when we did her histopathology and her cultures, she grew back 2 organisms I'd never even heard of before. And so we did use a 10-day course of antibiotics, and that's all we needed. And she lived a very happy, healthy life after that. Chronic ear infections, wonderful to use ozone lavage for these guys. This is a ear cytology, and I don't know if you can appreciate it, but it's just loaded with rods, just all over the place. We did 2 ear flushes, and 36 hours later, the ear cytology has no bacteria, and I did not use any antibiotics. This is Rocco. This was a great case because Rocco came to us with a severe head tilt. He had been to his regular veterinarian, who then referred him to a specialty service. And the owner just got more frustrated because they kept adding more and more drugs, and his head tilt got worse and worse, and his ears got worse, and he was just feeling miserable, and he quit eating. So we did our major autohemotherapy along with all of our other therapies. And this was him immediately following his first treatment day. His head is already a lot straighter than it was when he came in. We had 3 total treatments over a period of 10 days. And on the left, you can see he's a beautifully happy dog with a normal head. And the owner was amazed because for the first time in his entire life, his skin had cleared up. And it was because we treated the inflammation, didn't just treat the ear. This is Ritz, 14 years old, male neutered Jack Russell Terrier, presented with a acute head tilt and circling. Now, a lot of us would think that maybe a differential in his age bracket with that presentation might be a brain tumor. Well, he had also a very severe infection, so we decided to do ozone and both in major autohemotherapy and treat his ear. This is him the next day. So I know all of you would be able to clear that infection up, but how quickly could you do it? That is remarkable. The next day, this dog is totally normal and has remained so since. This is Moon. She is a Labradoodle, came to us because she was straining to urinate and the owner was concerned. She had other dogs that had had bladder cancer before, and sure enough, Moon had bladder cancer. So this is where the ultrasound picked up the transitional cell carcinoma, and we treated her. 5 weeks later, the mass was gone. But that wasn't the end of the story, because Moon also had this huge lipoma on her lateral chest. And it had been there for 2 years. It had been aspirated a few times. Everybody just said it was a lipoma. But during the treatment course, as we were treating her cancer, this thing melted as well, and it abscessed out while she was at home. And so they brought her in on emergency, and here you can see she has a lot of inflammation in that skin as that tumor, as that lipoma tumor, whatever it was abscessing out, had a super high white count. She presented with almost 50,000 white count, but I did not put her on antibiotics. And it's not that I'm opposed to antibiotics, it's just I think we should use them when we really need them and not just because they're convenient. And in this case, we flushed it with ozone a couple of times a day, lasered it, used hyperbaric oxygen therapy on her, and this thing healed up beautifully in an extremely short period of time. This is Ratchet. He presented, he had gone to his regular veterinarian because he'd broken a tooth. They extracted the tooth and couldn't get the bleeding to stop, so they sent him to a referral center. The referral center did an ultrasound and discovered that he had an enlarged spleen. They did a fine needle aspirate, and Ratchet had been diagnosed with a splenic lymphoma. The owners did not want to go the route that they were given at the referral center, and they were given a very poor prognosis as well. So they came up to me and we started our treatments. This was Ratchet's live blood when we began. It looked like sludge. And this was him an hour after his first treatment in our magnosphere, our pulse electromagnetic frequency. We continued treatments, and at 3 weeks, we were able to get red blood cell separation, and we could see him improving day after day as well. So as the blood started to separate and look better, so did Ratchet. Came in at the 10-week mark to take an ultrasound and see how we were doing. Ratchet has his own Instagram and his own Facebook, so we had a lot of followers that were rooting him on. And we did his ultrasound, and to our very, very happy and blessed day, he had a normal spleen. So we had this read by a board certified radiologist. And actually, he wasn't even convinced that this dog had had lymphoma. So we got the original ultrasound to show him. And he said, yeah, he had lymphoma, and whatever you did must have worked. Here he is on our celebration day with a lot of the therapies that we did for him. This is Chikari. She was 10 years old, squamous cell carcinoma in the nose, had been to a referral center, gotten her diagnosis. Owner did not want to go the route that they had recommended. So she came to us. She lived a little far away, so she would come 2 days a week and do our whole 5-step program, which of course included our ozone. And as we started treating this dog, it actually started looking a little worse. You know, a lot of our tumors, we don't get to watch them. Well, just like Moon's tumor on her side, it melted and abscessed out. The tumor has to do something. And in this case, we were able to actually watch what it was doing. It got very inflamed and very angry, started looking like it was going to the other side over these next couple of months. And then by the 16-week mark, we looked in her nose and there was no tumor in there. And it has now been over a year and a half, and there has been no evidence of any regrowth of that tumor. This is Tucker. He was referred to us from another veterinarian. She diagnosed an osteosarcoma. He was non-weight bearing on that leg. We started our therapies on him. You could see the inflammation and the lysis in the bone. We continued doing all of our normal therapies. And as we monitored him, we could see that the lesion was starting to resolve. And within 3 weeks, he was back to walking and playing on his legs. So he felt great. It took a few more months, and we were able to get this lesion to resolve. So there he is with his conclusion. Happy boy. This was Prowler. She is an American Eskimo. She presented to us because the referring veterinarian had diagnosed her with liver cancer and gave her just a few weeks to live. The owners wanted to have other options, so we started working with her. And they didn't have a lot of money, so we only worked with her once or twice a month. And we rechecked her about a year into our therapies, and the ultrasound report came back, no evidence of liver cancer. Her parents own a gym. She is a big part of the family of the gym members and of course her parents. And she is loved by everybody. She is doing fantastic. And for a dog that was given a 2-week life sentence, she is now a year and a half past with an absolutely thriving behavior. Let's leave the world of cancer right now and move into kidney disease. So this is a kitty cat that presented to us with a history of vomiting. He'd eaten a plastic leaf, so the owner thought he had a foreign body. And Oreo turned out that he had some kidney issues. So we gave the owner a guarded prognosis, and she wanted to try everything we could do. So we hospitalized him, and we did IV therapy. We did, of course, his IV ozone, and we did lymphatic therapy, laser therapy. And here you can start seeing very dramatically, he was getting IV fluids as well, but very dramatically, we're seeing that creatinine and BUN coming down, and within 72 hours, he was back to normal. Took him a little bit longer to get back his appetite, but he has had no relapses since. This is Jim. Jim had an argument with the other dogs in his household, and they tore his neck open. So here we are getting ready to prep for surgery, and that, my friends, is his jugular vein. Yes, it was a little daunting to see it hanging out like that. So we sewed him back up, and the only things I really did for him was, he did go on antibiotics, was silver and gut support, some Traumeel, and laser and ozone every day. So the owners brought him back on a daily basis. We did rectal ozone, ozone flush on his neck, and laser. And you can see he's just healing remarkably. So they had just flayed him open from his ear. He's laying on his back, and this is his neck. They filleted him open all the way across his neck and across his shoulder. This dog did not lose one stitch. It was remarkable how quick he healed. He was eating in 24 hours. So, you know, I said ozone helps you have a good feeling of wellness. This dog was eating in 24 hours. This is Max. Max was left out in the Florida sun without any shade. We get a phone call that the dog has a skin infection and they can't get it cleared up. So they bring the dog in, and I try to hose this off to see what was underneath all the crusties, and the skin just sloughed off. So we were doing major autohemotherapy the day that when we came in, we put a catheter in, we got biopsies and cultures, and then we did major autohemotherapy. Every day after that, he had ozone rinsing, he had salt booth therapy, we did rectal ozone, and it took a couple of weeks, and then all that dead tissue just peeled off. And I know you're eating lunch, so I'm sorry, but look at that beautiful granulation tissue under there. That's pretty impressive. And then 3 days later, we can see that it's just beautiful healing going on and contracture of the wound. And he went on to fully heal with the map of the United States. Here we are in Florida. All right, this is Dazzle. Dazzle came to us for humane euthanasia because when the owner found her that morning, she was just loaded with maggots. We didn't think she needed to be put to sleep for that, so we used combination of just ozone and laser therapy, and in 48 hours, her wound was totally healed up. I can't take all the credit. I think the maggots did a really good job to help me. Nevertheless, she did really well, and most of her nutrition came from eating the maggots as they fell out. This is Luna. Luna, owner didn't know what happened when she brought her in. She just knew that the dog had yelped, had a bowel movement on the floor, and was profusely drooling. It turned out that Luna had bit through the electrical cord of their Christmas lights above their bed. And if you can appreciate, this is the tip of her tongue, and here's the burn all the way about 50% back on her tongue. Really deep burn. And obviously the concern, here it is on the commissure, the concern was if that burn went all the way through her tongue and her tongue necrosed off, this dog would have been unable to eat and drink. So that would have been the end of Luna. So we used ozone on the hourly basis. We gave her rectal ozone, but we also sent the owner home with ozonated saline, and she dripped ozone on this tongue every hour, along with some silver hydrosol and laser therapy. We never put her on antibiotics. And within 24 hours, she was eating. 7 days later, her tongue had fully healed. And you can see there's a little bit of a scar in there, but she's fully functional. This is Uno. She had presented for a very severe rash around her vulva and inner thighs, a lot of scalding. We had, the owner had taken her to the University of Florida, and they put her on massive amounts of different kinds of antibiotics, and she got a little bit better, but she didn't really fully ever get rid of this. So we hospitalized her. I was concerned there might be something in the environment that was triggering this. We hospitalized her, and when I went into the hyperbaric chamber with her, I noticed that there was some urine, just a tiny bit of urine dripping from her vulva. And I figured out that it was the urinary incontinence that was creating most of the scalding. So we were able to fix everything in just a very short period of time, but we used no antibiotics. This was all done with hyperbaric oxygen, ozone rinsing, rectal ozone on a daily basis, and laser therapy. Wounds, this little dog Pistol had puppies, and the owner didn't want to put her on antibiotics. One of the other dogs in the household had bit her in the thigh. So we used ozone and laser, was able to heal this wound up in just a matter of a few days. This is Bon Jovi. Bon Jovi is how you're supposed to say it. And it was a dehorning that went bad. The owners were unable to get this to heal up. In 3 days, we were able to treat it with ozone rinsing and laser, and Bon Jovi went home doing great. Snake bites, we had a lot in Florida. This dog came in with a huge amount of swelling over here, and we used a vial of antivenom, laser, and ozone. 36 hours later, this dog had no swelling left in her lip. Now, if you weren't questioning, was it really a snake bite? This was her live blood. These are echinocytes. They're a hallmark of snake bites. 18 hours later, all the echinocytes are gone, which coincided with all the swelling gone. This is another dog that came in with a snake bite. You can see a lot of swelling. This dog was 14 hours, all the swelling was gone. Little Chloe had an eye ulcer, but she was 15 years old. Mommy and Daddy didn't want to put her under anesthesia, so we had to come up with a different route to fix this, and we ended up using ozone rinsing every day along with laser, and this dog healed in 4 days. A lot of my other eye ulcers don't heal that fast, so I've gone to using ozone and laser for all of my ulcers now. This is Fred. He came in with the tooth root abscess, and he had abscesses underneath his chin. So apologize again if you're eating lunch, guys, but these are so cool. So here he is. We lance the abscess, and then we are flushing it with ozone on a daily basis and using laser therapy, and it healed up beautifully. This is a little deer. She came in having been hit by a car, massive fracture coming to her leg, and we use ozone to not only start stimulating her immune system, but also to give her some pain relief and make her feel better. Now we're going to switch to a lot of our intervertebral disc cases. This is Sammy. She was 15 years old when she became acutely paralyzed. They took her to their vet, and he referred them to a board specialty service who told the owners that very likely she had lymphoma in her spine, and they recommended euthanasia. The owners did not want to do that, so here she is coming to us. This is on day 4 of therapy. If she had not gotten any better than that, they would have been thrilled because she could use a litter box. But at 4 weeks, she was walking almost normally. Sammy is now turning 19 years old, so she's doing really well. Apparently did not have lymphoma. This is Kim. She had gone to a referral center in December of 2018 for acute paralysis, intervertebral disc disease, and the owners didn't have enough money to be able to do the surgery. They didn't find me until February, so we started our regime. Here she is standing on day 4. You can see her. She actually takes a step on her left hind leg, and then 2 weeks after she went home, the owner sent me this video. She was actually walking before this, but look how cute this is. Very rewarding. No surgery, no steroids. And this is prolotherapy. This is where we take our cruciates and our severe cases of arthritis. We're injecting into a knee. Prolotherapy is where we take a mixture of different ingredients that we inject into the joint, and then we put ozone behind it. And then in our practice, we do laser lights, also intra-articular. This is what it looks like with the different colors of laser lights. This is Zeke. He had 3-legged lameness, had a cruciate injury for over a year, and the owners finally decided that surgery was going to be out for them, and we decided to do this. And here he's weight bearing and has not had any more problems since. So that was in April of 2019, and we are already into September of 2020. Rudy also had a very chronic cruciate. He walked 3-legged. This is him post-surgery with the prolozone injection. And you can still see he has a wonky gait, but this is a week later. This little guy's trotting around now, so he did really well. Now, this little guy, she was 18 years old, presented to us because she couldn't lay down. She was crying all night long, and the owners were unable to get any sleep either, but they weren't ready to say goodbye. So we did an entire workup on her. You can see she's head pressing, circling, probably had no quality of life at this point, but I want to caution everybody that, you know, sometimes we are too quick to judge and say, oh, it's time to say goodbye. These people weren't ready to say goodbye. And just take a moment right now and think about somebody that you've lost. It could be a person, it could be another animal, and just ask yourselves, what would you give to have one more day with that individual? And so I thought about that with this dog, and I gave him the option to have more time. And we were able to give them a whole month longer. You can see she had severe spondylosis. This was all the work that we did. And I got a text message from her on the 3rd day. Guess who got 8 hours of sleep? Oh, that girl. And we had another wonderful month with amazing quality of life before it was time to say goodbye. This is Beavis. He was a feral cat that the owners brought in, and he had an upper respiratory tract infection, very severe. We know these turn into very chronic sinusitis, rhinitis cases. So we started ozone, changed his diet, put him in our salt booth, and then on the 2nd day, we were rinsing his eyes with ozone as well. He started looking better. This is day 3, and he is now a couple years old. He's doing fantastic, has never had a cold since. Abby presented to us as a non-thriving dog, and we did our workup, and was very challenging to get her diagnosis, but it turned out she had an hepatic shunt. We sent her to the University of Florida to see if she was a surgical candidate, but she did not have a portal vein, so she was not a surgical candidate. The university said that she had a very poor prognosis, would not ever do well, and consider euthanasia. Owners didn't want to do that, so they came back. We started doing our monthly ozone and laser and magnosphere and her diet change and all the things we did to support her. This is Abby. We are 2.5 years from that period of time, and she's the cutest little button you've ever seen. Here's the money shot coming up. Boom. She just loves showing you her belly, and she just wants belly rubs all the time. So she's doing very well. This was her before picture and her now picture. What a difference. Now this is two of my hepatic shunt families. We just saw Abby on the left, and Bobby on the right came to us, really was just wanting to get neutered, and his veterinarian had done his blood work and found his ALT was over 700. So they came to us and they didn't want to do surgery. We started doing our therapies on him, and we are now 4 years down the road, and we are able to keep this dog with fairly normal liver enzymes by doing monthly ozone. Well, guys, I am out of time. It was fantastic to spend lunch with you guys. I wish I could have done it in person. This is a way you can stay in contact with me. If you want any more information on the things that I do, I love to help you.
Well, thank you, Dr. Siegel, and thank you for sticking with us. I told you that we were going to have a free gift for you if you made it this far. And so if you will write to us at info@o3vets.com, just shoot us a quick email. We are going to send you a tube of our pet liniment, 10%, for just the cost of shipping. You need to mention that you saw this at the AHVMA lunch meeting, and we'll go ahead and get that shipped out to you. Make sure to leave your name, clinic name, and your address, and we'll go ahead and get that out to you. Of course, again, we will need a couple bucks for shipping, but the product itself is free of charge, and we think you're going to love it. So I look forward to hearing from you about that. Don't forget the training that we have coming up in October. Get registered at o3vets.com. And again, thanks so much for being here. Bye.